those spinal bones joints, their job is to absorb load, stress from the daily environment, but their job is to surround and protect your spinal cord. Now, we know, through science and through many autopsies, through, how many countless anatomy books, that every system in your body, and the systems are cardiovascular, that's your heart, your respiratory system, your digestive system, your reproductive system, your skin, your kidneys, and your urinary system. All these different systems are completely coordinated and controlled by one other system, which is your central nervous system. Now, for me, that's enough to know that I should take care of this system. Now, your central nervous system is completely housed and protected in bone. Your skull surrounds your brain, and your spinal bones surround your spinal cord. However, there has to be a way for these messages from your brain to get out to all of your cells, all of your tissues, and all of your organs. And that's through the spinal nerves. We are completely covered and wired in spinal nerves, in nerves that come from the spine. There are holes on the side of the bones that allow the nerves to make their way through. We call these intervertebral foramen or intervertebral holes. That is where the nerve comes off of the spinal cord and then takes its messages out to the body. That's how your low back nerves can also control digestion, your bladder, and your reproductive organs. So when we have misalignments, when we have joints that have shifted outside of their normal range, what happens is those joints cause muscular tension. They can cause dural tension. They can cause direct pressure from the bone to the nerve. It can cause the disc in those areas to become inflamed. It can cause the facet joints in that area to become inflamed. All of these things can cause inflammatory issues on the nerve, which will irritate the nerve if left there long enough. That simple amount of inflammatory irritation can decrease the nerve's ability to coordinate the messages from the brain. Now, you have pain signals that live on those nerves, and the point of those pain signals is so that if any pressure or irritation is present, our body can be notified of it so that we can resolve the issue and make sure that nerve is back to working order, just like a check engine light in your car. However, the average American does not take care of their body the way they take care of their car. Most people don't take care of these warning signs. We just take pain medicine and we just get back to doing the thing that was causing us the problem to begin with. But again, the University of Colorado did a study that said it only takes the weight of a dime on your nerve to decrease its function by 60%. That means that with the weight of a dime, which you would not feel, by the way, that was another part of the study, no one felt this weight, we were seeing reductions in the nerve's capacity to carry messages. So that means you are functioning at 40% of your optimal. And the average American, just look around and you'll notice that we're not functioning at optimal. I'm not functioning at optimal. I'm not going to sit here and tell you I'm perfect. Most Americans don't sleep enough. We drink too much coffee. We have too much stress, and we don't do enough things to combat these stresses. Meaning, we don't move enough. We don't sleep enough. We don't have a good bedtime regimen. We don't mitigate our stress with mindful breathing. Right? These are all things that we should be doing. And when we live our lives in a constant stressed out state, we can also cause what we call emotional subluxations. So there's a few different ways you can get a subluxation. One of them is the physical, through the misalignment in the spine. That can be caused by a traumatic event, car accident, slip, fall, sporting accident, But what we're really seeing is that the more common way that we get these subluxations is through repetitive trauma, repetitive micro trauma. That means whatever you do day in and day out generally will cause shifts in your spine. One of the best things we can use as an example is the forward head posture. This is when you see somebody whose head has shifted really far beyond their shoulders, and generally that's because they had some sort of a desk job or they have been using their phone too often, whatever you want to call it. That shift will cause too much stress on the spinal joints in the neck. They will begin to degenerate, and then those discs that are really there to hold space, remember we talked about those nerves popping out of the side of the spinal column. Those discs are there to hold that space open so that the nerve can make its way through. And if you're losing that disc, you're losing that space, which means that nerve will become compressed. And the University of Colorado already showed us that if we have compression on a nerve, it will not function properly. So yes, chiropractors will help with your pain, but that's only part of the equation. The reason why we're able to help kids, and the reason why I myself have helped kids that were wetting the bed every single day, the reason why I've been able to help people like that is because I just listen to where those nerves are coming from. I'm not making that happen. That is a miracle that's already living inside of you. As long as we remove that interference, your body will function the way God designed it, which is properly. So stop taking medicine for things that might just be coming right from the inner workings of your body. For example, another couple of ways you can get subluxations, and we'll wrap this video up quickly because these other two ways can get really heady, there's a lot to talk about. However, what we think about, the amount of stress we bring into our lives, that can cause emotional subluxations. And those can be really hard to take care of. If you have an emotional tie to an issue, it can actually cause your spine to torque and twist. And that is not good. And those can be really hard to get rid of. Until you make peace with that stress, until you mitigate that stress and you find ways to breathe through it, you might always have that issue. These are the people that constantly have really tight and just rock solid ropey neck muscles, and they're constantly having headaches, they're constantly having anxiety. That's what these people tend to present like. The other ways you can get subluxations are through toxins, the things you eat. What you put in your body 100% dictates what comes out of your body or how you express it. It's as simple as this one example. If you take two people who have exactly the same genetics, and one eats good, clean, healthy food, white meats, green vegetables, all the colorful vegetables, fruits, right? And mitigates its fat intake, unhealthy fats, and eats good healthy fats, and then you take the other person and have them eat McDonald's every single day. We've already done this. the video of Super Size Me, he ate nothing but McDonald's, and he literally started to transform. His health was transformed. And that is a perfect example of what you put in will dictate what comes out. So what you eat and what you take into your body also is a big part of what ends up coming out. So I hope this video was helpful. What chiropractors do is we take care of subluxations. Generally in our office, we try to help people with nutritional subluxations so we can help them to find a better diet, a better balance to their life in terms of sustaining a good, healthy diet. We also take care of those physical traumas, those physical repetitive stresses, and we do that by adjusting the spine. We use gentle and specific chiropractic adjustments in order to realign that spine, and then we give you homework. We give you muscular exercises to help get your brain to start talking to the muscles again so that we can rewire your habits. That which you do every day sticks, and so we have to start getting you to stop sitting X and start sitting Y. We have to get you to stop doing X and start doing Y. When we do that repetitively, you start to change, your body begins to heal. We need to take stress off of those nerves long term so that they can begin to heal. One adjustment will make you feel better, one adjustment will not heal anybody. Those nerves need time. So all healing takes time. So again, we are here to serve. If you want to figure out how you can start living your life to its fullest, we would love to help you. I would imagine anybody watching this video has some level of subluxation in their spine. If you don't have pain, that is exactly fine. You don't need to have pain before we start this process. Start taking care of your nervous system. That is the most precious thing you have in your body. Your nervous system controls and functions and to coordinate every other part of your body. You guys have an awesome day. Like this video, subscribe, share it with your friends. Can't wait to see you next week. Good morning, guys. Welcome to Real Talk with Dr. Sean. Obviously, I am Dr. Sean. I'm going to be going over a pretty interesting conversation today. We talked about there is one thing that could be completely stifling your health. One thing that can cause things like low back pain, neck pain. It can be causing things like numbness and tingling in your hands, maybe numbness and tingling going down into your legs. I know I'm speaking to some people right now because I'm honestly used to be one. So I get it. I know the struggle. There is one thing though that can also impact your digestive health. One thing that can make it really hard for you to integrate stresses in your life. One thing that can give you anxiety, that can give you headaches, that can give you sinus pressure, allergies. Something that can make it really hard for you to even become aroused. There are certain simple facts about our central nervous system that we can't ignore. And what I'm talking about, the one thing that can cause all these problems is a subluxation. Now that word is something that tends to get ignored, maybe because people don't think it's real, maybe because people don't want to acknowledge that there is something that simple that can cause all kinds of problems. Maybe because from a common medical perspective, something that simple doesn't really make sense. How can that one thing, how can a spinal joint that has become less than perfectly aligned cause all kinds of issues with digestion, cause things like headaches, cause things that our medicine is supposed to cure today, that we're supposed to have fixes for through a pill, a potion, or a lotion, or some sort of injection, or whatever it might be. I think we want to put chiropractic in a box, and we want to say that chiropractic is great for fixing your pain or fixing your, headaches. I guess we're okay with that. Even numbness and tingling, people are okay with, chiropractic being the ones that take care of that. But as soon as we start helping people with digestive issues, as soon as we start helping kids that are wetting the bed every single day, as soon as we start helping people with anxiety and they're no longer having to take their medication, as soon as we start helping people be able to lower their blood pressure medicine, all of a sudden we're talking about curing things that we can't cure. Now, again, I've never been the one or the chiropractor to say that chiropractic cures any one thing. What I do know is that a subluxation, like we just talked about, can cause all of these issues in your body. Now, that's not an opinion, that's a fact. There is plenty of research to back it up. I am not going to quote any for you today. These videos are meant to be more raw. If you want real research, go to the Journal of Chiropractic. You can go to American Medical Association. There are definitely articles out there published by the medical society themselves that have had to acknowledge the importance of a subluxation. However, what I'm going over is what a subluxation is, how do you get it, and realistically, why can it cause all these problems? The truth is, a subluxation, I'm gonna sit down, it's getting a little cold out here. A subluxation is a misalignment in a vertebrae. So you have 7 vertebrae in your neck, right? You have 12 vertebrae inside of your middle back or your thoracic spine, right? That makes 19, and then you have 5 lumbar vertebrae. Some people have 6, but most of us have 5. That means we have 24 vertebrae or bones in our spine, and their one purpose is to absorb load,